Hi, it's Tom here from Running Physio. Today I want to talk to you about how we can help some of our patients that perhaps have complex multi-area needs without overburdening them. And in this video we're going to use patellofemoral pain as an example and hopefully give you lots of strategies that you can use to help patients you see with patellofemoral pain in clinic. I've also put a link to our free videos available over on Clinical Edge. We've got lots of great videos there on iliotibial band syndrome, tendon pain, lower back pain, etc. Do check those out. I'm sure it will give you lots of new ideas for assessment and treatments of people you see in clinic. So let's start by talking a little bit about these patients we may see that have complex needs. And many patients I see, actually some fairly simple strategies can be really effective. Perhaps we just need to scale back their running a little bit and add in some strength work, and often they'll do really well. But we all see a number of patients who have much more complex needs. Perhaps they've had persistent pain for a long time, and we feel there are lots of potential targets for treatment. Now that's a good thing, but it can lead to this feeling of the patient of being overburdened. And that's something we need to think about when we're coming up with treatment plans for patients, is consider the treatment burden. So the more things we perhaps give them to do, to take away and work on at home, the more they've got to fit into their life, the more of a burden those treatments have. And actually, in a way, the more of an impact this injury is having, because they're having to do lots more things they don't really want to do to manage it. So there are ways that we can address this and hopefully get better results for patients. So let's think about this in terms of patellofemoral pain, and let's think about it with a hypothetical case study. So we're working with a lady with patellofemoral pain, and we've done a good assessment. Perhaps we've had a couple of sessions together where we've really helped kind of work through and identify this lady's rehab needs. And we've developed a bit of a to-do list in a way. So working with this lady, we've realized that one of the things we want to do is reduce pain, obviously. But she's also told us that she's keen to help reduce her weight because she feels she's become overweight with inactivity, and that's influencing her pain. She's keen to return to goal activities as well. But our assessment suggests we could improve her strength, particularly around the hip and the knee. We could improve her control with some movements like single leg balance and single leg squat. We could try and build fitness because long term she'd like to get back into running. We could try and improve her mental health because she's identified that actually anxiety and low mood seem to increase her pain and her distress related to pain. We could try and modify some of the activities she's doing that are painful as well. And we may also want to restore power if this lady wants to try and get back into running and sports that need powerful movement. So there's potentially a really quite a big to-do list here. Now, there's a phrase I quite like that sort of sums up my thoughts on this, which is, if you chase two rabbits, you won't catch either one. And sometimes that can be the case when we develop this great big lengthy kind of treatment plan or to-do list with a patient, and we focus our efforts into multiple different directions of restoring strength and control, of returning to activity, maybe helping mental well-being, fitness, weight management. There's so much for the patient to go away and do that they just feel overwhelmed and they can't really get much success there. And I'm sure you'd have encountered this with a lot of patients. Perhaps they've come back, you've had a good session together, but they haven't really applied the things you agreed on together. And so they haven't really made progress. And often what we end up doing is stripping things back. Now, there's an approach I quite like, which I find works quite well with complex patients with multiple needs, which is a block-based approach. So it's a little bit similar to a kind of periodization you might see in sport and strength training. And it's about identifying the rehab needs and then focusing on maybe one key area at a time. Now, this makes it much easier for the patient because they can have one focus at a time, and it makes it much easier for you as a therapist because you're not trying to address multiple different things at once. And now these blocks then can vary in length. Sometimes they might be a short block, maybe 3 or 4 weeks if we're trying to calm symptoms down. They might be longer, 8 weeks plus if we're looking at a particular area. And let's talk through some examples then that we could use. So let's say this case study, this lady, she's presenting with really quite irritable symptoms, and pain's the main concern for her at the moment. And we want to be driven by her, by the way, with this. We can identify these potential treatment blocks and let the patient choose where they want to start, what they want to focus on, put the power in their hands. So perhaps she says, I'd really like to see if we can calm this pain down. So let's have a 4-week treatment block where the focus is mainly on calming symptoms. And that's the main goal here. We're not so concerned about trying to build strength or enhance power or anything just yet. Let's focus on getting you more comfortable. So in that block, we're going to focus on that. We're going to improve her understanding of pain to reduce its threat value, which can help. We're going to look at load management and taking away, or at least reducing, some of the aggravating factors for a short period of time to let it settle. We might choose to use some hands-on techniques if that's appropriate, if it helps her pain. Things like taping might be appropriate in this stage if it helps pain during various provocative tasks. We might bring in 1 or 2 exercises, but the focus is very much in this first 3 to 4 weeks is to kind of calm things down, let things settle, and develop that understanding of pain. Now, once we've completed that block, if you like, we can then think, what's the next thing that this person would like to focus on and devote their energy on? And again, we place them in the driving seat. So we talk about some of the options for this lady. She's mentioned her weight is something she wants to address. So we could say, well, what about having a block designed to help you with weight management? So we speak to your GP, perhaps we get you to see a dietitian or a nutritionist, and actually we make the focus over the next maybe 8 to 12 weeks on trying to help you with your weight, which will reduce the stress on the knee and have multiple other benefits. And that's often the way with these blocks. Although we might be focused on 1 or 2 areas, it can have knock-on effects to multiple areas elsewhere. So it isn't really just working on one. It can have benefits elsewhere, but it allows the patient to focus. So perhaps the patient agrees that that's what they want to do. It allows them to think about the diet changes they might want to make, perhaps bringing in some low-level cardiovascular work, looking at some of the other factors involved in their weight to actually be able to be successful in that specific goal, rather than chasing lots of rabbits at once, as we kind of touched on earlier. So perhaps the patient does that and that leads to some improvement. Their pain is starting to feel better. They feel now that they're back to perhaps their normal weight or close to their normal weight, and they feel ready to try the next treatment block, and again to shift their focus on the next thing. And again, we can think about the options that we have available. It might be that we focus for the next perhaps 6 to 8 weeks on return to valued activity. Again, we allow the patient to choose and pick what they want to really focus on. So that might be around trying to gradually return her to her walking or cycling, or potentially start to reintroduce aspects of running if she feels that she wants to do that. But it allows her to focus on that specifically and for us to plan for that specifically. Perhaps we feel actually that in order to help her do that block of returning to her goal activity, we maybe want to address some of the other rehab areas first, and that's perhaps what the patient wants to focus on. So instead, we might say, let's have a strength training block where the focus is on strength. Again, typically about 6 to 8 weeks is a good time period for this. So we might have a block of low load strength training for this lady's knee. So these are going to be activities with lower stress on the patellofemoral joint. So perhaps we bring in some hip strengthening exercises, things like side lying abduction, single leg bridges maybe, that don't really stress the knee a lot. And maybe we bring in some knee loading, but in limited ranges, like shallow squats with small load. And we make that the next rehab block. Perhaps as she's improving, we think about the next strength block, perhaps going to medium load activities. Perhaps now we're loading up these activities a little bit more, perhaps loading up the squat, starting to put a bit more load through the knee. And again, we work on that for a period of time before maybe another block looking at high load activities where we're pushing the weight with things like squats, maybe leg press, maybe seated knee extension, or perhaps pushing more into range, into flexion if that's challenging for this person. But it's a structured approach where we can focus on one thing at a time. Now, the reality with patients with complex needs, with persistent pain, for many years, and this is actually represents a large percentage of the people I see in clinic, is it does take time. It's not an overnight success story. So it is actually, I think, quite reasonable to focus on these different areas, little by little, progress the person towards the goals that they have. So let's recap what we've talked about so far with these blocks. We might have a calming down block to let things settle. We might, because the patient's identified weight management as a key goal for her, have a weight management block to see if we can bring her down to her target weight with help from other health professionals. It might be that we would have a strength training block to address the strength needs we found specifically and progress that over time. But there are other options too. Perhaps this lady has said that her mood and mental well-being seems to be a big important factor to her, and that's what matters. What's important to her? What does she want to focus on in each of these phases? So maybe then we say, okay, well, if you are struggling with your mental well-being and you're finding that is increasing the distress that you have related to your knee pain, perhaps we would be better focusing on a block, maybe again 8 weeks, something like that, of really trying to focus on addressing this one area of improving your mood and mental well-being, and again getting the right people in to help with that. So perhaps working with a GP or counsellor, having some regular therapy, looking for other strategies that can help with mood and mental well-being. And in patellofemoral pain, there's evidence to support that adding mindfulness to standard practice can improve outcomes. So allow that person to focus on that area before coming back and perhaps thinking about what else they might want to focus on. We could also perhaps have an activity modification block where we're focusing mainly on maybe gait retraining. If we think there's a particular aspect of their running gait that is contributing to pain. Or that activity modification could be spending time focusing on particular provocative activities to see if we can alter them to make them a little bit more comfortable in this person's knee, as another way of reducing their symptoms. So we've got lots of different options here, and I think what I would probably take away from what we've talked about so far is really do think about the burden of treatment. It's a phrase that I picked up on a few years ago that really made me think about what I am suggesting a patient to do. And with the best will in the world, we think if we give people 20 strategies, we've done a good job, but actually we might be overburdening them and giving them far too much to think about. So it may be better to focus on these specific blocks, one thing at a time, with a specific goal for each block, and empower the patient by letting them choose what they want to focus on at each time. And that can then get really good results by focusing on those particular parts as we go. Now, if you're working with people with patellofemoral pain and you're watching this, maybe you've got some questions about some of the specifics in these blocks or the evidence behind some of these approaches, do let me know in the replies and comments. I think really what this starts with is a good assessment of the patient to identify their needs, and then realistically thinking through how can you address it, how can we put them in the driving seat, and choosing what we can focus on in each specific area. And quite often you are going to get a bit of an overlap between these blocks, but often what you can do is use maintenance strategies to continue some of the good work on. So let's say, for example, this lady's chosen to do some work on her mental health as a specific focus for a couple of months, and she's found that as part of that, maybe doing some relaxation has been really helpful. So she could continue that aspect of that care perhaps as she moves into her next block of treatment. Perhaps she's done some strength training and that's really helped the knee feel more comfortable, but she doesn't feel she needs to continue it 3 times a week. She could continue with a maintenance dose of once a week, which has been found to help maintain the strength we gain through rehab. So perhaps some aspects of these things can be retained as we go on to focus on other specific areas to maintain the improvement they've got from using them. Okay, thank you very much everyone for listening in again today. I hope you found it useful. Do let me know what you think in the comments and replies, and I'll look forward to speaking to you again very soon. Thanks again for listening. Bye for now.